20 million Americans are living with a disease that is slowly destroying their nerves right now, and most of them have spent years being told it is something else entirely. Anxiety, aging, poor circulation, vitamin deficiency, stress. They get prescription after prescription, none of it works, because nobody identified the real problem. Today I am going to show you exactly what peripheral neuropathy is, why it is one of the most misdiagnosed conditions in American medicine, the 7 warning signs your nervous system is sending you right now, and the one question you must ask your doctor at your very next appointment. Sign number 5 is the one that sends millions of people to the wrong specialist, costing them years of wasted treatment, while the real damage quietly gets worse. Your nervous system has 2 parts. Your central nervous system, your brain and spinal cord, and your peripheral nervous system, the vast network of nerves that branch off from your spine to every corner of your body, your hands, your feet, your organs, your skin. Peripheral neuropathy happens when those peripheral nerves are damaged, disrupting the signals between your brain and the rest of your body. When the signal is disrupted, you feel pain where there should be none. You feel nothing where there should be feeling. Your muscles weaken, your balance disappears, and your body slowly loses its ability to communicate with itself. The causes are many, but the most common by far is diabetes, which accounts for 60 to 70% of all peripheral neuropathy cases in the United States. High blood sugar damages nerve fibers the same way it damages blood vessels, slowly, silently, and permanently. Other causes include vitamin B12 deficiency, thyroid disease, autoimmune conditions, certain chemotherapy drugs, and in many cases, the cause is never found at all. Here are the 7 warning signs your nerves are being damaged right now. Warning sign number 1: tingling or burning in your hands and feet. This is the earliest and most classic sign of peripheral neuropathy. A pins and needles sensation, like your hand fell asleep but it never fully wakes up, or a burning warmth in the soles of your feet even when they feel cold to the touch. This happens because damaged nerve fibers begin misfiring, sending random electrical signals to the brain, signals that feel like tingling, burning, or buzzing. Most people blame this on poor posture, sitting too long, or poor circulation, and do nothing for months or years while the nerve damage progresses. Warning sign number 2: extreme sensitivity to touch. The bed sheets feel like sandpaper. A light breeze across your skin feels painful. Someone touching your hand gently creates a sharp, unpleasant sensation that is completely disproportionate to the pressure applied. This is called allodynia, and it is your damaged nerves misfiring so severely that even the lightest sensation is interpreted by your brain as pain. Many peripheral neuropathy patients cannot wear socks, cannot walk barefoot on carpet, cannot tolerate the feeling of water on their feet. Warning sign number 3: numbness that starts in your toes and slowly moves upward. Peripheral neuropathy typically begins at the farthest point from the brain, the tips of the toes, and slowly progresses upward toward the knees in what doctors call a stocking and glove pattern. First the toes go numb, then the foot, then the ankle, then the lower leg. The numbness is not complete, it comes and goes, worse at night, better in the morning. By the time a patient reaches the knees, significant nerve damage has already occurred. Warning sign number 4: falling or losing balance without explanation. Your peripheral nerves carry the signals that tell your brain where your body is in space, a sense called proprioception. When those nerves are damaged, your brain loses its sense of where your feet are. You reach for a step and misjudge it. You stand on uneven ground and your body does not automatically correct. You trip over nothing because your foot did not lift properly, because the nerve signal telling it to lift was damaged. Many patients are told they need physical therapy for balance. They do, but the real cause is their nerves, not their muscles. Warning sign number 5: sharp, shooting, electric shock pain that comes without warning. Not a dull ache. A sudden bolt of pain, like being stabbed or electrocuted, lasting a fraction of a second, then gone, then back again without warning. This pain sends millions of people to orthopedic surgeons, chiropractors, and pain specialists, who treat the muscles and bones, while the actual source of the pain is the nerve fiber running alongside them. This is the symptom that leads to years of misdiagnosis, back surgery that does not help, joint injections that do not work because nobody tested the nerves. Warning sign number 6: muscle weakness in your hands and feet. You struggle to open jars that you used to open easily. Your handwriting has gotten worse. You trip on your own feet. Peripheral neuropathy eventually damages motor nerves, the nerves that carry movement signals from your brain to your muscles. When motor nerves are affected, muscles begin to weaken and waste. Many patients notice their grip strength declining first, then the small muscles of their feet, creating a shuffling, flat-footed walk that gets progressively worse. Warning sign number 7: symptoms that are significantly worse at night. This is the detail that distinguishes peripheral neuropathy from almost every other condition. Almost universally, neuropathy patients report that their burning, tingling, numbness, and pain is dramatically worse at night, often preventing sleep entirely. This happens because during the day, movement and activity distract from the nerve signals, and the pressure of standing compresses the nerve fibers slightly, reducing the misfiring. At night, lying still, with no distraction, the damaged nerves fire freely. Many patients describe lying awake for hours with unbearable burning in their feet, while their feet feel ice cold to the touch. Now, the one question you must ask your doctor. Ask specifically for a nerve conduction study, also called an NCS or EMG test. This test sends small electrical pulses through your nerves and measures how fast and how strongly they respond, revealing nerve damage that no blood test or MRI can detect. Without this test, peripheral neuropathy is routinely missed, even by experienced physicians. If you have any combination of symptoms on this list, insist on this test by name. Nerve conduction study. Write it down before your next appointment. The good news, when the underlying cause is identified and treated early, nerve damage can be slowed, halted, and in some cases partially reversed. For diabetic neuropathy, blood sugar control is the single most powerful intervention. For B12 deficiency, supplementation can restore function in months. The window for meaningful recovery is open, but only while nerve fibers are still alive. If this video helped you, share it right now with someone who has diabetes, or someone who has been complaining of burning feet, tingling hands, or unexplained pain that no doctor has been able to explain. They may have had peripheral neuropathy for years without knowing it. Subscribe and hit the bell, because in my next video I am going to reveal the disease that silently destroys your joints for years before you feel a single symptom, affecting 1 in 4 American adults, and the 5 signs that appear long before the pain becomes unbearable.